Let's speak to Rachel Bannister, co-founder of Mental Health Time for Action, a charity which wants to see fully funded NHS mental health services. Good evening, Rachel. And I guess that is the question, whether this is going to be fully funded.
Yeah, thanks, Mark, for having me on today. First of all, I want to say anybody that works in mental health or leads a charity like mine, people with lived experience, will welcome this, because we know, so much that services have been underfunded for so long, and we've talked about early intervention for so long. So this does have, it's an important step forward, and it does have real potential. But there's a couple of things that come to mind for me. And first of all, as you said, it's the funding of it. So Yvette talks about, I think, 343 million. I don't know if I've got that figure right.
Yeah, but close, yeah.
Yeah, but I think that also includes some new builds. Is that going to be enough? And is that funding going to continue, or is it going to be reviewed every year? So, I think that's a really important point that many of us are concerned about. And I guess the other thing is what's on offer can't be more of the same. So it can't. We know that community services currently, inpatient services, they offer therapies, they offer ways of working, and it's not working for so many people. It didn't work for my daughter, it didn't work for me when I was unwell. So we do need to look at doing things differently. And so on that point, I would like to draw attention to the viewers, to yourself, but also I'm talking to Yvette Cooper directly herself. It's very important that she's made aware of the biggest care model randomised controlled trial in mental health in the world, which has recently concluded, and the results will be published imminently in The Lancet. And this has been trialling an approach called peer-supported open dialogue. It's an approach that came from Finland, and it's patient-centred, person-centred, it's a relational care model, it involves the person and the social network. And so I think if these centres want to have any chance of success, then we need to look at the results of this trial. And we don't know the results yet, but we're hoping they're going to be positive. But what we do know is that staff retention rates are 5 times higher in open dialogue, and we've got a staff retention crisis in the NHS. So if that really wants to make these work, I suggest that she looks at the trial, speaks to myself and Professor Russell Razak, who's the lead psychiatrist of the trial, and looks at training people in this way of working.
Right, because it's interesting what you say about staff and trained staff, because this talks about using existing staff. And I guess, I don't know quite how that is going to work. And as you say, much of the money is going to be on some new builds. Some are an existing business, of course. But it does need real investment, not least
it's absolutely not going to. It's not going to work if we're basing this on existing staff. We've got a massive crisis. I think there obviously needs to be more money invested and money into proper training. And I think if you can train people in peer-supported open dialogue, and believe me, by September, everyone will be talking about open dialogue. It's already been in the Financial Times. I've been on the Today programme to talk about this, and that will save money in the long run. But crucially, it will keep people in their posts, and so people will have what was missing from my daughter's care. They will have continuity of care, because that is built into that way of working. Right. And you don't want people turning up at these neighbourhood centres and seeing somebody one day and then somebody else the next day. There needs to be a team of people on the ground there, and these are new people, I think, that need to be trained in this relational care approach. And then 6 months later, if they come back when they have another crisis or they can feel themselves slipping, they'll see that same team again.
Yeah.
So if she wants
it's
to
about
make
trust, isn't it? It's about trust and relationship building. But Rachel, it is about early intervention within a community setting, which we've talked about it many times.
We have, yeah. And that's what we've all been shouting about for decades, but it's never actually happened. And for it to happen, I think, to be honest, it needs more than 343 million. It really does. That's just a figure. What will that pay for? I'd like to see a breakdown of what that will actually cover before I can have real faith in this process. And I would like to meet with Yvette. My daughter would be happy to come along, talk about what went wrong with her care, what she wasn't able to access, and she wasn't able to build up relationships, build up trust. And until you have that, you don't feel safe enough to share your story.
So listen, I just want to talk very briefly about your daughter, because I know that we've talked a lot about provision for eating disorders and so forth.
Yeah.
Have in your experience, have things improved when it comes to eating disorders. And I should say these kinds of walk-in centres may lead to some early interventions in that.
Well, I mean, I'm sad to say things haven't improved. They certainly haven't. But there are, having said that, some pockets of good care across the country. And BEAT recently published a report, There's No Place Like Home, which champions early intervention in the community. So it is happening. It's happening at the Royal Free London. It's happening in other places around the country where they treat young people with eating disorders in the community and keep them, especially young people, in adolescent life, as opposed to the anorexic world that my daughter existed in for 2 years. But I mean, that needs more investment, doesn't it? If someone turns up to one of these centres and they've got eating issues, body image issues, where are they going to be referred on to? Is that centre going to offer some support for people with eating disorders? Because it should. And I think the other thing I think is really important is that we look at offering different therapies alongside open dialogue, which is where we'd organise a centre, and that would be the way that we are with people, and we interact with people and how we listen to them. I think we need to be much more ambitious about therapeutic pathways, because CBT doesn't cut it for so many people. It hasn't cut it for anyone in my family. So I want to see art therapy, EMDR, somatic therapies, drama and movement therapies. So that's what a really good neighbourhood hub drop-in centre should look like. And if we don't see that with the open dialogue as the way of running it, then we won't get what we want.
Yeah, listen, good to talk to you, Ray. Yeah, good to talk to you again, and thank you very much, and good luck with...
Can I just say, if anyone wants to read any more about open dialogue, then on our website we have a whole page about open dialogue. So good. Yeah,
good.
Directing Yvette Cooper to there as well, hopefully.
Yeah, I'm sure she'll be interested. But listen, come on and talk about it. We just haven't got time now, but thank you very much.
When we've got the trial results. Okay, bye.
Yeah, when the results come out. Thank you very much.